Good evening. Welcome to the National News Broadcast. I'm Kasuni Balachandra.
Good evening indeed. I'm Thilina Udayaratna. For starters, we take a look at tonight's top stories.
Quarantine curfew extended until 4 a.m. on the 1st of October. The President's direction is to only give the Pfizer vaccine for children. The number of COVID-19 patients exceed 227 million globally. The government guarantees that there are no harmful disease-causing microorganisms in organic fertilizer that will be imported for the Maha season. Venerable Dr. Madagoda Abhayathissatthera says everyone should support to solve problems internally if there are issues in the country.
Moving on to those and other stories in detail. President Gotabaya Rajapaksa has instructed relevant authorities today to give only Pfizer vaccine for children. The President gave the instructions during a special COVID Prevention Committee meeting held over video technology. Meanwhile, it has been decided to extend quarantine curfew until 4 a.m. on the 1st of next month. President Gotabaya Rajapaksa paid his attention on the vaccination program of the children. Director General of Health Services Dr. Asela Gunawardana pointed out that priority should be given to vaccinating children between the ages of 12 and 19 years who are suffering from chronic illnesses. Recommendations of the Expert Health Committee have been received in that regard. The Director General of Health Services said that children would be vaccinated under recommendation of a clinical specialist and with the permission of parents and only at a clinic. The President inquired from the Specialist Medical Committee on vaccinating children between 12 and 15 years. The committee pointed out that other countries have not taken the initiative yet. However, they said recommendations have been made to give vaccines to all those between the ages of 15 and 19. President Gotabaya Rajapaksa gave instructions to complete vaccination of the children between 15 and 19 years soon. Children should be vaccinated only at hospitals. The parents should be correctly informed about it. There is a situation where youth expect selected vaccines. All vaccines are of equally high quality. Therefore, consultant Dr. Prasanna Gunasena and Professor Nilika Malavige pointed out that everyone should take vaccines without waiting for a special vaccine. The importance of sending post-COVID patients with complications for Ayurveda treatment was discussed. Attention was paid on establishing post-COVID patient centers at rural Ayurveda hospitals. The President emphasized the need to maintain activities at essential public service institutions such as Motor Vehicle Department and Land Registration Office. The President said heads of institutions should take decisions in this regard. Finance Minister Basil Rajapaksa pointed out that the economic growth rate has been maintained high during the first and second quarters of this year amidst the challenges. The minister thanked all stakeholders, including health and security officials, for their commitment. The President instructed to maintain essential services without disrupting civilian life and economic process and to keep all economic centers open. Attention was paid on opening rural schools with less than 200 students. The President emphasized the need for proper coordination between provincial health directors and the Ministry of Education. Meanwhile, it was explained the importance of briefing parents and children about health recommendations jointly by the Ministries of Health and Education. The President pointed out to the Chairman of Public Health Inspectors Association, Upul Rohana, that encouraging people to get vaccines is a main responsibility of the public health inspectors. He said that public health inspectors are also entrusted with guiding those who are engaged in small and medium-scale businesses and self-employment to maintain their livelihood without obstructions. The President instructed the IGP to strictly implement laws against those who violate quarantine curfew and health recommendations.
China has decided to donate 1 million Sinovac COVID-19 vaccine doses to Sri Lanka. The Chinese embassy in Sri Lanka mentioned this, issuing a Twitter message yesterday. The Chinese embassy in Sri Lanka said that the vaccine doses are donated to the country to further enhance the vaccination process in Sri Lanka. Sinovac is the COVID-19 vaccine that has been mostly used in the world. 24,558,102 vaccine doses have been given to the people under the COVID-19 vaccination program. 13,690,202 have been given the first dose of a vaccine. 10,867,900 have been given the second dose of a vaccine. 1,066,267 doses have been inoculated in the past 7 days. 94,657 vaccine doses have been given yesterday. The vaccination of persons between the ages of 20 and 29 is taking place in many districts. Persons above 30 years residing in the Nuwara Municipal Council limits were given the second dose of the Sinopharm vaccine at the Nuwara Family Health Services Centre today. The vaccination program at the Battaramulla Diyatuyana premises is being continued by the Army. The second dose of the Sinopharm vaccine can be received at the premises. A special program has been implemented to vaccinate all those above the age of 30 in the Batiklo district. 1,278 COVID-19 patients were detected from the country today. 58,258 persons are currently receiving treatment. Meanwhile, 1,186 patients left hospitals today following recovery. The total number of fully recovered patients is 429,776. The Director General of Health Services has reported that 121 COVID-19 related deaths occurred yesterday. 92 out of them were those above the age of 60 years. The number of victims between the ages of 30 and 59 is 28. One of the victims is under the age of 30. A program to provide medical equipment for the coronavirus treatment unit at the Anuradhapura Teaching Hospital took place yesterday under the patronage of State Minister Channa Jayasumana. The value of equipment is 5 million rupees. The Ittapana Sarananda Karuna Foundation donated goods of a value of 3 million rupees yesterday for COVID-19 treatment centers in the Kalutara district. The donation has been made under the guidance of Venerable Valalavata Sarananda Thera. Police have arrested 816 persons who violated quarantine regulations during the 24 hours ended at 6 a.m. today. 73,894 have been taken into custody in connection with these offences. State Minister Dilum Amunagama says that steps will be taken to introduce a concession package for 17,000 private buses.
Meanwhile, the Deputy Director General of Health Services, Dr. Hemanta Herath, made remarks on the reopening of the country.
In the opening of the country, again, question was raised whether the situation in the country at the time of the closure of the country or lockdown or whatever the restrictions imposed that time, whether the situation in the country is as same as at the time of closure and today. I would say that is not. The situation has been improved to a great extent. However, we know that till we are receiving over 2,000 cases and over 100 deaths reported every day. So therefore, we have to be very vigilant and we have to be very careful when deciding on the opening of the country. And more than that, opening can be done at any moment and can be done in stages or completely or whatever the way. But our behavior will decide whether it is going to be conducive to the spread of the disease or not. It is the people's behavior finally decides as to what will happen if the country is open. So therefore, I would like to urge the public that we have to determine and make sure that whatever our behavior should not be conducive of spreading the disease if and when the country is open or relax these restrictions in future.
Consultant Dr. Disna Amaratunga says it is essential for heart patients to get both COVID-19 vaccine doses.
It is mandatory for you to take the COVID vaccination. And it doesn't matter the brand or the type of the vaccination that you are getting. It is mandatory for you to get the 2 doses of this vaccination. And at the moment, any active or chronic cardiac illness is not a contraindication to take the vaccine. And all the cardiac patients who are on aspirin, clopidogrel as well as ticagrelol and warfarin can go ahead with the vaccination. And if you are on warfarin, you have to check your INR before getting the vaccination. And if your INR level is less than 3, you can go ahead with the vaccination. And if you had bypass surgery, stenting, as well as pacemaker implantation or any other cardiac surgery in the past, we don't consider it as a contraindication to go ahead with the vaccine. And if you are a cardiac patient, during this period, it is very important for you to keep your health status in a proper way. You have to continue all your medications, including aspirin, clopidogrel, ticagrelor and warfarin, and as well as all your antihypertensive medications, and continue your usual exercises as well as healthy food habits. If by any chance if you infect with this COVID virus, then at that point also we advise you to continue your current medications, but you have to stop your usual exercises. And it is very important to keep an eye about your symptoms, because cardiac patients are more vulnerable to get the complications from the COVID, and also COVID virus has the potency of infecting your heart as well as the cardiovascular system and the conducting system as well as the cardiovascular system. And because of these things, the patients are at a vulnerable state to get cardiac illnesses due to COVID.
Well, in COVID-19 news overseas, the cumulative total of global COVID-19 cases rose to more than 226.2 million, with the death toll exceeding 4.65 million as of yesterday, according to the World Health Organization. The cumulative total of confirmed COVID-19 cases in the United States has exceeded 41.78 million as of today, with the death toll reaching nearly 669,930. According to health reports, the United States continues to lead the world in the numbers of both confirmed COVID-19 cases and deaths. According to official figures released yesterday, an additional 26,911 people in Britain have tested positive for COVID-19, bringing the total number of coronavirus cases in the country to 7,339,009. The country also recorded another 158 coronavirus-related deaths, pushing the total number of coronavirus-related deaths in Britain to 134,805. Meanwhile, the World Health Organization says that Africa faces a 470 million shortfall in vaccine doses this year after the COVAX alliance cut its projected shipments, raising the risk of new and deadly variants. The global agency's Africa unit has said that only 17% of the continent's population will now be vaccinated by the end of this year, compared with the 40% target set by the World Health Organization. Moreover, Cuba has begun a COVID-19 vaccination campaign for children between the ages of 2 and 10, saying it was necessary.
And in other local news, the Ministry of Health has decided to make permanent 1,391 substitute health staff assistants. The appointments will be made on cabinet approval and on the advice of Health Minister Kelly Rambokwella. This was disclosed during a discussion which took place today under the patronage of Health Minister at the Ministry. A group of representatives of Sri Lanka Nidahas Health Services Union attended the discussion. There are about 120,000 health workers in the health service. 22,000 out of them are health staff assistants. The minister said that the service rendered by all sectors of the health service amid the pandemic is immense and all citizens are grateful to them. He said that the Finance Ministry will give any amount at any time for the activities of the Health Ministry. The Health Minister said that attention will be paid to provide solutions for issues in the health service.
Agriculture Minister Mahindanand Alutgamage says that the government guarantees that there is no disease-causing microorganisms harmful to any plants, animals or humans in the organic fertilizer that will be imported for the forthcoming Maha season. He mentioned this during a media briefing in Colombo today. Minister Mahindanand Alutgamage said that there is a standard specified when importing fertilizer to the country by the Sri Lanka Standards Institution. No one can import fertilizer without that standard. Imported fertilizer should not contain microorganisms harmful to humans, animals and plants. He said 3 organic fertilizer containers have been retained outside the harbour. The auditor's report for 2020 says that substandard fertilizer has been brought by changing lab reports and distributed to the people.
Welcome back, and now we take a look at more local stories. Minister Sarath Weerasekara says that the maximum punishments will be given under the Criminal Code for persons who threaten teachers engaged in teaching online without joining the strike. He mentioned this during a discussion today with officials of teachers and principals unions at the ministry. The minister was informed about the death threats levelled by the persons who conduct teachers' strike against teachers who teach online. Minister Sarath Weerasekara said that the CID has been asked to implement the law against persons responsible after obtaining the relevant telephone conversations. Information can be given on 118 and 119 telephone numbers. He requested the teachers to continue with teaching.
තර්ජනය කරනවා නම් 118ට හෝ 119ට කතා ගන්න අපි වහාම මේ පුද්ගලයන් හොයාගෙන ඊටම තදින් නීතිය ක්‍රියාත්මක කරනවා. මේ සමස්ත ගුරු පරපුරටම නිගා දෙන මේ දෙදෙනා සංවිධානය කරන වර්ජනයට සහභාගී වෙලා ඉන්න සියලුම ගුරු මෑණිවරුන්ට සියලු ගුරු පිරිවෙන්ට මම ඉතා ගෞරවයෙන් ඉල්ලා සිටිනවා නැවත උගන්වන්න පටන් ගන්න. ඒ වගේම මේ මේවන විෂය දෙන්න ගැනත් අපි දන්නවා. ඒ දෙන්නම ගුරුවරුන් හැටියට වැඩ කලක් ඉගන්නපු අයත් කියලාත් අපිට සැක සහිතයි. එක්කෙනෙක්ට තියෙනවා මුදල් අක්‍රමිකතා චෝදනා 9ක් තියෙනවා. අනිත් එක්කෙනාටත් ඒ වගේම
A discussion took place yesterday between Education Ministry Secretary Professor Kapila Pereira and all teachers and principals unions. Chairperson of Podujana Education Services Union Vasanta Handavangoda says that certain trade unions did not allow to conduct the discussion in a fruitful manner. Chairperson of Podujana Education Services Union Vasanta Handavangoda said that a group identified as a collective of teachers and principals are challenging other unions, which is similar to terrorism. The behavior of groups who say that they give leadership for teachers is similar to terrorism. They do not allow any other path to express their views.
Chief Prelate of the Papiliana Sunetra Devi Piravana, Venerable Professor Madagoda Abethissa Thera, says that everyone should support to solve issues internally if there are problems in the country. He mentioned this during a media briefing held today. The Chief Prelate of the Papiliana Sunetra Devi Piravana, Venerable Professor Madagoda Abethissa Thera, said that there was an accusation that the Sri Lanka army committed war crimes. There is a new accusation stating that the Sri Lankan government should be held responsible for the Easter Sunday attack, and especially the justice process is not sufficient. These are not accusations levelled against the government, but against the country. It has been said that the Easter Sunday attack could not be prevented due to weaknesses in the state, and persons in the state should be punished. The Catholic community was more affected by the Easter Sunday attack. During the past few days, a youth made a statement saying that the government used the Easter Sunday attack to come into power. He was taken into police to question for making such a baseless statement. 2 Catholic priests came with him. They supported the LTT at the time. Therefore, it can be said that there is a conspiracy. It is quite unfortunate that when the war heroes who sacrificed their lives to end the war were identified as war criminals, and those who failed to say they were peace delegates and tried to highlight this as a fault of the country or the government. Accusations have been levelled for those who have been keeping certain groups under custody by the Human Rights Council. However, even after 20 years following the 9/11 attacks, those who were responsible have not been penalized. The process is still moving. When the Dalda Maliga was attacked, we did not ask to punish those who did it. When the Sri Mahabodhi was attacked, we did not ask them to be caught. We asked them to end terrorism. Therefore, the clergy and the cardinal should be careful as a group of matured persons, because political groups can use them. The main issue is to arrest the real respondents of the attack. All support should be given to that end. Madrasa schools in the country have not ended. The extremists are taking forward their programs. The government has to remove the ISIS name board from Muslims in the way it removed the LTTE name board from the Tamil community. Therefore, ending extremism should be supported. Legal action should be implemented against respondents. However, the opportunity should not be lost to nab the persons who committed the crimes by working for political agendas. Therefore, the Catholic community and clergy are requested to solve the country's problems internally.
The Ministry of Mass Media has planned to establish a coordinating center for differently abled persons. The aim is to provide opportunity for them to attend to their needs without any difficulties and to coordinate with the external society. The centre is scheduled to be set up at the ground floor of the Media Development Centre of the Government Information Department. Media Minister Dala Salaha Peruma and a group of representatives of differently abled persons held discussions today on the way that the centre should be set up to suit the needs of them. Chairperson of the Joint Front of Differently Abled Persons, Rasanjali Patirage, and several others attended the discussion. The minister instructed officials to organize everything that could be used by them. Attention was paid on preparing access paths, sanitary facilities, entry paths for visually impaired, and vehicle parking facilities for the differently abled. The representatives expressed their gratitude to the mass media minister for taking lead in such matters. They requested the government to provide such facilities at all state institutions for Sri Lanka's differently abled persons.
The Defence Ministry says that the public should not panic over information that is being circulated, stating that there is a threat for the Bandaranaike International Airport. The Defence Ministry has announced that the circulation of false information on the threat has commenced after officials received a fake email of an attack at the airport. The Defence Ministry said that all necessary steps have been taken for the security of the airport. All institutions empowered to look after the security of the country and to implement laws are taking measures to prevent activities that may disrupt the peaceful situation at present.
The 157th birth anniversary of Anagarika Dharmapala falls today. A pioneer in the freedom struggle of the country, he is considered as a person rendered an immense service for the Sinhalese and for Buddhism. He was born on 17th September 1864 as Don David Heva Patirana and later changed his name to Dharmapala. He worked together with the Mahasangha and the people against influences to the country and religion by foreigners and missionaries. He was against alcohol use and the killing of cattle. He was able to get the support of foreigners such as Henry Steele Olcott of the US. Anagarika Dharmapala played a prominent role to establish Buddhist schools by opening Colombo Mahabodhi Society in 1891. The Buddhists were able to get back Buddha Gaya in India due to his efforts. He was ordained in 1931 as Siri Devamitta Dharmapala at India's Moolagandhakuti temple and passed away at the age of 78 years. A commemorative ceremony was held in connection with the 157th birth anniversary of Anagarika Dharmapala at Maradhana Mahabodhi temple today. It was held under the patronage of Minister Dinesh Gunawardena. Floral tributes were paid to the statue of Anagarika Dharmapala. A group of people, including Registrar of India's Sanchi Viharaya, Venerable Bhanagala Vimalatissa Thera and Venerable Ambulagala Sumangala Thera of Mahabodhi Viharaya were present on this occasion.
Well, that's a wrap on tonight's Rupavahini English News. Join us once again tomorrow. Until then, thanks for watching. Take care. Good night.
Good night.